even in crisis situations like this, people will still continue to fall ill or have exacerbations of their chronic conditions. So they have the double jeopardy of managing their own conditions as well as the potential of contracting an infection.
In this pretty stressful period where things are quite uncertain and every day there are changes, definitely we have to take good care of ourselves so that we can take good care of the patients and one another.
PHCT is population health and community transformation. What we want to do is to look after the full population of the North. The two nursing programs that we have in the community are quite distinct. The first is our hospital to home program. It consists of all the efforts that we do to help a person on discharge from the hospital to recover from their episode of care. The second is community nursing. The nurses here look after persons living in the community who may not even be our patients yet. They may be seeing primary care doctors, and what the nurses do is to help them with their care in between consultations.
MDM in short is multidisciplinary meeting. In this meeting, it is a team of doctors, allied health and nurses coming together to discuss the cases that they are going out to see in the community. Normally, these are complex cases, and that's why it is a multidisciplinary team. And so that's where the doctors will advise the nurses. They sometimes may change the treatment plan. And then if the patient needs any rehabilitation, that's where our allied health partners comes in. And if they need drugs to be reviewed and to shorten the list, then that's where our pharmacies will come in to work with our doctors so that we manage the polypharmacies. So this is one end of the nursing work, that is the hospital to home portion. And then from the community, we have the partnerships, we have the GP, we have partners like senior care centers referring cases to the nurses. So we have a hospital down and a community up. So we are now at the phase of blending the whole team together.
So in this COVID-19 situation here, many of our patients are anxious and they are actually afraid to come to hospitals and even attending the specialist outpatient clinics. So in this kind of situation, it's actually very helpful for our community nurses to visit them in their homes to make sure that they are taking good care of themselves, that they remain well, that they are taking their medications correctly, and that the medical conditions are well controlled. So this goes a long way to keep our residents healthy in the community, so that they run into less problems of uncontrolled medical problems, for example, and would also cut down the need for them to attend the emergency departments or attend even the outpatient clinic visits. I think we have actually managed to support quite a few residents within their own home so that they now understand more about their chronic illnesses, for example, and they are more empowered to take care of themselves. They feel confident in taking their medications. I think that has helped to control their chronic conditions a lot better, and hopefully it would result in them going less into crisis and needing to come to the hospitals for treatment.
The benefit is that We have more understanding on how to deal with my mom, which at times he have fever, he have water retention. So usually I will call the nurse also to see what we can do, and then they are very helpful. They will usually answer my call. If it's not, I will just WhatsApp her when she's not around. Then she will get back to me as soon as possible. Have to be very careful lah. Even though she's an old lady, she also want her life to go long, you see. So we are just trying to see that she's comfortable, not having sickness at all, not having cough. You see, that will be very dangerous, and fever for her.
Some of our patients are reluctant of coming to hospital during these periods of time. We have to make sure there are no lapses in the medical care. By doing home visit, we can monitor the progression of their chronic conditions, and we will notify the doctor immediately if there is any deterioration. So at patients' home, we will be able to assist patients and their caregiver on the management of pressing their medical condition. We will also conduct chronic disease education and caregiver training for those dependent patients, especially on feeding tube or urinary catheter.
Community nursing post has made medical knowledge very layman to our community resident. We are able to bring forth and help them relate their long-term conditions in a very practical manner.
Yes, COVID-19 is here, we all need to stay safe, but life goes on. Instead of retreating, in fact, we scale up, we double our session. And to do this, and as part of this drive to do this, we pair up the admin staff to go in with the nurses. The administrators themselves can in fact take on the role, right? Some of the functions that normally done by nurses. That gives them the confidence as well. And for the administrator, it is also a good exposure because then they have a better understanding what is on the ground. Now the nurses are viewing the admin from a different light. Now they can see that, okay, I have now partners from the administrator. They are not just simply someone will help me with my IT, with my filing, with my paperwork and all that, right? And in fact, we also send in our senior managers to be on the ground. It's not just junior staff, even senior managers are on the ground. All of them have undergone training, right? They've been trained, and we also basically exercise the same risk management that we currently do in the hospital back into the community as well, to make sure that we are aligned, right? And what is important for the community when they see an administrator there, it helps to demystify health. It helps them to also then reflect on themselves, right? If they see an administrator doing some of the function that they typically associate with nurse, help them to go and think, what about my own role vis-a-vis my family? Can I not do that? Hey, it is not just nurses who are here on the ground. There's also administrator as well, right? Very much like you and me, not a typical nurse.
For persons with long-term conditions, they need support. They need skills to manage their own conditions. They spend about maybe 4 hours in a year with healthcare professionals. The rest of the time, they are actually managing on their own. That's where their knowledge and skills come in to help themselves. For better outcomes of their long-term conditions, patients really do need support for their own care in between consultations with their doctors. And this is where community nursing comes in.
Keep strong, have a lot of vitamins, Make sure your immune system is good and healthy so that together we can be one in combating COVID-19.
1, 2, 3.
PHCT cares for you. Rasa sayang, rasa sayang, sayang lihat nona jauh. Rasa sayang, sayang rasa sayang, rasa sayang, sayang lihat nona jauh. Rasa